Good morning, everyone. This is my name is Sean Quincy. I am with the Humboldt County Administrative Office. This is going to be our second episode of board updates related to COVID-19. Today we have 3rd District Supervisor, Mike Wilson. Mike, you want to say hi really quick?
Hello, everybody. Here we are, sheltering in place.
Yeah, so I've got, we talked a little bit yesterday, kind of full disclosure, this is our second take of doing this, but I let you know that we have a working title, Sheltering with the Supes.
I found some soup.
Oh, you did find some today, good.
Yeah, I found some soup. One can, we have 1 can of soup.
Sheltering with the Supes with soup.
We did not hoard soup in this house, but
maybe we'll make sure that we'll see what each supervisor, what kind of soup they have in each of these updates.
I can't tell you how old that soup is. So.
All right, so the purpose is to kind of address some community concerns, some community questions, and kind of give updates to Humboldt County about things that are going on in light of the COVID-19 pandemic. So. We'll try to keep it brief, try to keep it short, answer maybe 3 or 4 questions, and kind of go from there. So we'll just jump right into it. First question we have is, what's the most important thing that the community can be doing right now? We had some updates from Dr. Frankovich last week on Friday. So what's the most important thing for the community right now, Supervisor?
Well, hold on, I'm going to take this off because I just put it on just as an example of one thing that we could be doing, which is wearing our masks in public, but I'm not in public. I'm in my own home. So I'm going to take that off. Just let people, hold on one second. My wife made this, but there are plenty of people making them all over the community. So reach out if you need one from somebody. I'm going to say the most important thing to do is shelter in place. Limiting your exposure by not going outside your home as much as possible. Stay home with your family unit. Don't gather with other people anywhere. Remember that when you're outside and you have to go to the store for essential services or whatever it may be, 6 feet if if possible. And these days recommending wearing a mask I think is also important. So and they're becoming more fashionable now, all kinds of flavors and tastes of masks in terms of fashion style. So please get those going. And it really appears that we're doing a good job. I mean, we need to always do better. We're always improving on our limiting our interactions and our stay-at-homeness. And the curve is flattening. At least the preliminary data indicates that this is working. And so it's really important we keep on it. The sooner we get a control on this and clamp down on it, the actually shorter the amount of time that we're going to have to be dealing with it in this way. And so I want to really encourage people to adhere as much as they can to their shelter in place order. I think it's very important.
And we've also heard, I heard Dr. Frankovich over the weekend talk about how this next week and the next coming weeks are really important because, in other models, this is when a surge happens. So, knowing those things, can you talk a little bit about what the county and what other agencies are doing to get ready?
Sure. So the first bit, the first part of this, responding to this epidemic, really was on prevention and mitigation in the context of the wave of infections coming. And now a lot of the effort has shifted into really preparing for hospitalizations. Now, Humboldt County, as far as I know, the last count was about 3 people hospitalized currently, which may not seem like a lot, but that could surge more. And we want to have capacity for that. And so the team that is the Offices of Emergency Services and our public health team, which is dozens of people working on this daily all over the county. They're working on making sure there's hospital bed availability, working on how to do transportation, interagency and interfacility transportation, really looking for alternate care sites, because we know that if we have a real surge like we're seeing in other places, that even the capacity within the hospitals is probably not enough. And so we're really looking at other places where that might happen. And even, talking about what mass fatality planning might look like. And we don't want to be there, we don't want to get there, but we have to be prepared for those things. And I am pleasantly, not surprised, but pleasantly feeling good about the team that we have in Humboldt County and the work that they're doing on all those levels. And I can tell you, they're working real hard, not just in the county, but in coordination with both the state and federal government, but especially within the state, those agencies that are the public health and the OES, they have the people that they work with throughout the state, and they're getting good ideas and resources and trading those things around. So it's really everyone working together.
Yeah, the response to this is, even from what I've seen is just incredible. Right now I know the Emergency Operations Center, I mean, it's flooded with people. They're doing that.
It's like a beehive.
Yeah, that and the Joint Information Center, there's people that are there, all hours of the day working extremely hard on this. I'm extremely proud to be, a county employee right now and seeing this response.
And I want to remind people too, there are phone numbers and email addresses and all that stuff that you can get more information. So I don't have it here right now. I'm going to tell you because it's all over the internet. I'm assuming you're watching this on the internet, so use your Google.
Yeah, the Humboldt County website, humboldtgov.org. You'll find all the information there. Switching gears a little bit to a little bit of a lighter note. I've seen questions around parks, and there's a little bit of confusion about what people can do in parks. So what do you know about the shelter-in-place order, how it relates to parks? Are we encouraging people to go to parks? Should people be going there? Should they be going on the playground equipment?
Ooh, no, stay off the playground equipment, kids and parents. No touching playground equipment. Please stay away from those things. I want to remind people that getting outside is really a healthy thing to do. We need to be getting out. It's good to, not be in the same house with your relatives all the time, that is good. But, and also in those of us who maybe are sheltering in place alone, it's good to get out and see that there are people out in the world, don't get too close kind of thing, but understanding that, we do live in a community that, and having that at least visual connectivity and walking outside and seeing the birds and seeing life is important outside the walls of our homes. And so walking is great for the mental health, it's great for our physical health, going out for a run, even going out for a bike ride. These are all good things, making sure that we're really practicing this physical distancing. And I think it's very, very important. Understanding that, touching and or getting near playground equipment, not a good idea. That could be a vector for transmission, so please stay away. And understanding that we've had some issues where some parking areas in parks and some have been a problem in terms of people getting too close to each other. So please, if you find if you're going to go to a park or someplace like that where you feel like you have to drive to it, please, really practice distancing there. And if a parking lot looks too full, please move along to another place. We have plenty of space. So, really try very hard not to crowd people in places as much as you can. And understand that some parks, like the state and national parks, have their restrictions as well, and those need to be respected. But I also want to remind people that many of us who live in town, we have miles and miles of trails all around us. We can walk right out our front door. They're called sidewalks. We can walk everywhere. I mean, all over the place. And it's a great opportunity to get to know your neighborhood better, or to even try out those walks that you never thought you would do. Like if you live in some part of Eureka, walk all the way down to the waterfront and back and see how long that takes, or what that might look like, or walk to a local park, like Sequoia Park, or here in Arcata, walk to the marsh maybe instead of drive, or walk, just walk around your neighborhood. I think it's really important. And I want to stress too, take take notice and take inventory of that infrastructure that we use as, you know, as we are walking and biking around, and what do you want to see improved in that in the future? Because now's a good time to take that inventory, check it out, use it. And especially now when traffic is a lot less, you know, maybe this is a really good time. You might feel safer to walk in those places that maybe didn't feel so good before, but now is a good time. So get out there, walk, ride your bike in your neighborhood, check it out, get to know your neighbors from a distance. That's what I would say.
If there's a silver lining to all this, right? That's one of the good things, is to, you know, see a lot more of your neighbors kind of active, walking around. You know, I've seen more of my neighbors and my neighborhood than I've seen, you know, in a long time. So that is one positive that I'm taking out of this.
Yep.
Last question is going to be about helping out. How can people help out? What's the best ways for them to help out? Are there good places for them to donate or volunteer?
Well, I have kind of maybe three that I would list. The first one for me would be, you know, Humboldt Area Foundation. I think is a really good place to, if you're just looking for a place to give money, right? You're like, I don't know where to give money to, but we have a lot of organizations. I mean, unless you already have organizations within the community that you feel like you need to, you know, that you already are familiar with and want to give money to, that's great. But Humboldt Area Foundation has a fund, COVID relief fund, and I think it's important that that's a great place to give money to. They've already given money to, you know, several tribal organizations. I have notes over here, and I'm looking over here. They're giving it to 211 Humboldt, which is an organization that helps, you know, bring people together with information that helps people out. The Affordable Homeless Housing Alternative, AHA. So those folks are doing great work. I mean, you know, in terms of like working with people experiencing homelessness, they have a mobile shower unit, and they're reaching out into places to really help people, you know, really stay afloat in this time. Arcata House Partnership is a place that I have, you know, a fondness for in terms of, you know, all the work they do with people struggling, you know, on the edge. I mean, part of it's not just helping people who are experiencing homelessness, but also trying to make sure that people don't become homeless. And that, I think, is really important as well. You know, Cooperation Humboldt has received some money, and I think that's a great organization. The Rescue Mission and Food for People, which I will transition to. Food for People does take volunteers to help them package things and that kind of stuff. So reach out to Food for People. They'll tell you how you can do that in a way that's safe. You know, I want to make sure that everyone is being safe in that regard. And then I think giving blood is another good way. And then certainly, you know, there's not a shortage, or, you know, it hasn't been a drop in the need for blood supplies, both locally and in the United States. And so donating blood is important. So I encourage people to reach out and do that as well. So those are, I think, three reasonable things to do. What do you think?
Very good. Very good. No, I think that's great. It's a lot of great options. I particularly like the donating blood. I've heard a lot of that kind of reiterated. I've even heard Dr. Vrankevich talk about, you know, right now you can still donate blood and still practice good social distancing. And like you said, you know, there's not going to be any shortage of demand now.
No.
Yeah. So thank you very much for taking some time, Supervisor Wilson. I appreciate it, and thank you for demonstrating some good face mask techniques.
Thank you for joining me in my pantry.
All right. Thanks a lot, Supervisor Wilson. Continue to stay safe. All right.
All right.
Thanks a lot.
See you later.